Welcome to our channel Hashmi Clinics.
All right, let's jump right in. Today, we're going to be exploring a remedy that, often sits on the shelf but holds some absolutely profound potential. ARAGALLUS LAMBERTI. Now, this isn't just going to be a quick review of keynotes. Think of this as more of a postgraduate masterclass. We're going to sharpen our clinical acumen and hopefully see this remedy in a whole new light. So, let's get started. The story of ARAGALLUS really begins with its common name, loco weed. And this isn't just some bit of folklore. It's a direct clinical observation from the natural world. The name itself is like the first prescription, isn't it? It points us directly to a state of neurological bewilderment, of profound confusion, and this fundamental loss of control. So from that really powerful name, we can start to distill the remedy's central pathological theme. This is what we're after, the core disturbance, the foundational idea that every other symptom logically unfolds from. And here it is. Look, if you only take one thing away from our time together, let it be this. ARAGALLUS is all about a fundamental disconnect. The will, right? The intention is there, but the message just gets scrambled somewhere along the way. And the result? A bewildered mind and a body that simply will not obey. This is the lens through which we have to view every single symptom. So let's see how this core disconnect actually plays out in the mental and emotional sphere. It's really crucial to get this. The loco state, it begins right here. It's an internal experience of incoordination and confusion, often long before any physical ataxia becomes obvious. The mental picture is one of deep apathy and fog. You see this great depression, a profound lack of ambition that the provings describe so beautifully as a satisfied indifference. It's like they're not even fighting it, they're just sinking into it. And this is coupled with a bewildered confusion, an inability to concentrate, and this really strong desire for solitude, just to escape the overwhelming effort of trying to interact. This single symptom, it just perfectly captures the remedy's essence, doesn't it? It's the bridge connecting that bewildered mind to the uncoordinated body. This simple, automatic act of walking now requires conscious, focused mental effort. It brilliantly illustrates that core disconnect between what they want to do and what their body actually does. And here we have it, a high-grade characteristic modality that is absolutely crucial for prescribing. The more they focus on a symptom, the worse it becomes. Now, sure, we see this in remedies like oxalic acid, but in ARAGALLUS, it's not just about localized pains. It's this pervasive feature that applies across the entire mental and physical state, making it a powerful, defining keynote. And this leads us directly into the physical plane. The confusion and the lack of control that we just saw in the mind, well, now it manifests as a tangible, observable failure of the motor and sensory systems. You can really see that central conflict laid out visually here. The patient intends to walk a straight line, but the execution is a staggering ataxic gait. They intend to control their limbs, but they experience this weakness and loss of power. And it's more than just weakness, it's a profound insecurity in all physical movement. Now, accompanying this motor disturbance is a very, very peculiar sensory symptom. This sensation of the spine feeling woody or pithy, it's highly characteristic. This is a pathognomonic keynote that points directly to the remedy's deep action on the spinal cord. When a patient describes this, ARAGALLUS should immediately come to mind. And these signs, they build a really clear and compelling neurological picture. You've got the classic locomotor ataxia, which is often confirmed by the loss of the patellar reflex. You add to that an impaired sense of touch, and these very specific pains and cramps, especially on the left side, and suddenly you have a complete image of progressive motor and sensory decline. Okay, so while the neuromotor sphere is certainly the star of the show, the picture of ARAGALLUS doesn't end there. Let's explore some of the other characteristic particulars that can help confirm our prescription and give us a more complete understanding of the remedy. As this chart illustrates, the nervous system and the extremities, they are absolutely the primary spheres of action, no doubt. However, we also see a really distinct and important impact on the head and senses, the genitourinary system, and the chest. And these areas often provide those valuable confirmatory symptoms that we need for a precise prescription. And some of these particulars are exceptionally strange and valuable, things like diplopia, double vision. The sensation of a wide band constricting the chest. In the male sphere, it's not just weak function, but a complete loss of desire and ability. And what about this peculiar fever with a chill that recurs with almost clockwork precision every 7th day? I mean, these are the kinds of odd, rare, and peculiar symptoms that just lock in a prescription. Okay, so let's synthesize all this information into some practical clinical wisdom. How do we confidently select Aragalis? And, just as importantly, how do we differentiate it from its closest neighbors in the Materia Medica? First things first, we have to be masters of its modalities. That aggravation from thinking about symptoms, that's paramount. But also note the aggravation from lying down, especially for head and heart symptoms, and that typical morning and evening dip with the depression. On the flip side, they can feel better after sleep, from gentle motion and in cool air. Now let's differentiate. Compared to Lethyrus, which also has paralysis, Aragalis has that profound mental confusion first. The Lethyrus mind is often clear, and its paralysis is much more spastic. With calcemium, just think of the classic 3Ds: drowsiness, dizziness, dullness, and that prominent trembling, which isn't so characteristic of Aragalis's apathetic state. And while, oxalic acid shares the worst from thinking modality, its pains are typically violent and sharp, totally unlike the dull, weak state of Aragalis. So to make this really actionable, here is a simple 4-step guide. 1. Find that bewildered, apathetic, loco state. 2. Confirm it with a physical ataxia. 3. Secure the case with that absolute keynote modality of being worse from thinking about it. And 4. Rule out its closest relatives by looking for spasticity or that deep calcelium drowsiness. I'll leave you with this final thought. In all those cases of chronic fatigue, or brain fog, or maybe even early-stage neurological conditions, how many times might we have seen this unique picture of profound mind-body incoordination, this bewildered apathy, and perhaps missed the call for Aragallus Lamberti? Something to think about.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.